Hello, my name is Dr. Patricia Sharon, and I'd like to tell you a little bit about what it takes to become a physician. I've been a member of Leroy Jefferson Medical Society for 10 years. I've been the president for 2 years, and I was the secretary for a couple of years as well. And during my tenure, we brought in a renowned speaker, Dr. Benjamin Carson. We did something very unusual. We had enough financial status to make Dr. Carson's lecture free to the residents of Riviera Beach. So it's been an exciting experience with Leroy Jefferson, and it's been an experience in growth, not-for-profits. Perhaps you'd like to know how I became a pediatric cardiologist. Well, I didn't start out in that road. I probably started out as a teenager, a middle schooler, wanting to be a housewife. I actually had all 5 of my children named, and no husband, of course. But during my high school years, it became clear that my mom was sick. She had cardiac disease, she had congestive heart failure, she'd have episodes of rapid heartbeats. I can remember one time we were going shopping for college materials for me, and she stopped and she just had to sit in the car while her heart raced. And I thought, Mom, shouldn't we call the doctor? She says, no, it'll stop soon. No, she was getting medical care, but I wondered if I could do a better job, and I suddenly became inspired to become a physician. That's all I wanted to do. I wanted to be an adult cardiologist. But when I did my pediatric rotation, it became clear that they needed help in pediatrics. I thought they needed a more internal medicine approach to general pediatrics, and that's what's happening now. We're working more with the cause of disease and treatment. But cardiology was still a love of mine, and while I was at Baylor College of Medicine in Houston, Texas, it was one of the biggest cardiac programs in the country. We were doing heart caths. We were performing arrhythmia studies. It was one of the few pediatric cardiac arrhythmia centers in the United States. So I had a lot of exposure to pediatric cardiology, and I knew that's what I wanted to do. I wanted to be the type of pediatric cardiologist that was in the preventive field. I thought perhaps we could manage these patients. We could look for other patients with cardiac disease and other illnesses. I remember once we had a patient with myasthenia gravis, and that's a neurologic disease. But just looking at her echocardiogram as a resident, I could see her heart was small, low volume, and I wondered, what could she do? What could we do to help her? Certainly a cardiologist was needed here. So I could see there was a lot to do in pediatric cardiology, and I got involved. I am also a mother. I have 2 children, a 28-year-old and a 13-year-old, so a wide span. And I think that's helped me become a better doctor. I try to be the type of mother that answers all the questions that my mother answered and my patients' mothers asked. I try to have answers for them by actually, if you will, living out what I'm preaching to them. So I think that gives me some validity to what I say in my practice to my parents and to my patients. I've really enjoyed that patient-parent relationship in my practice. Sometimes I actually think of them as more family members. They may not know that, but I do think a lot of my patients and my parents. Sometimes I correct them, and I feel a little guilty like their mother, but I can see the road down ahead sometimes, and I don't want them to head that way. One of the biggest parts of our practice has become pediatric obesity, hyperlipidemia, and hypertension. And those are preventable illnesses, particularly in adolescent medicine where we predominantly see them. They're diet related, they're lifestyle related, so I've started a whole new campaign against obesity, adolescent hypertension, and type 2 diabetes in children. Type 2 diabetes used to be called adult onset diabetes because only adults had that type of insulin depravity, but now we see it in children because we're eating so much, and it's preventable. So that's been a real love of mine. What challenges do I face really as a professional? Sometimes I wonder if I'm really being fulfilled, if this is really the direction I want my life to go. We're so busy. In pediatric cardiology, you probably have a 30% callback rate. That means once a patient's left the office, you're still working on their problems, you're still calling other specialists and talking the patient over with them, you're looking at studies that come back to your desk, and that of course takes a lot of time. So to be honest, when the day ends at 5, I'm still working till 8, or I take paperwork home, and that's been a real challenge. I think it's somewhat decreased the amount of time I'm able to spend with my own family. But I have to say that's all for the better part. It's for the good. You know, there's nothing like seeing a pediatric patient that was once, we say, blue baby, a cyanotic baby, and he's waiting for his surgery. There's nothing like seeing him come back from his surgery completely pink. It makes us all feel like superheroes, whether we're the cardiologists or the pediatric cardiothoracic surgeons. And certainly we respect our patients. We think that they're the super duper heroes if we're heroes. So it's really a fulfilling role. It's also fulfilling to work with the parents through the child's illness. You can't imagine what it must be like to say your child needs open heart surgery, meaning we're going to have to stop your child's heart for about an hour, 2 hours, completely put their child on bypass. And hopefully he wakes up and he's neurologically the same, and his heart is in better condition than we started in. And that's through the years, I've seen pediatric cardiology improve so much. That's almost an expectation, but we know that there's that 1, 2, 3% risk of, we say, mortality or morbidity. So that's a hard part of our practice, and that's something that we just have to live with. You know, we really encourage our patients to come back at their designated time of return, because we really can't predict the future. No doctor can. We just tell you an estimate of what can happen to you. So when the patient comes back, we're able to see how they're doing at that point in time. We run tests, we make sure that everything's okay, and hopefully if there is a problem, we get you to the surgeon or to the interventional cardiologist early on. Speaking of interventional cardiology, that's been one excitement in our practice, our field. Things are always changing. We're able now to put heart valves in the cardiac catheterization lab. No one ever thought that that would be possible 20 years ago. And we're really excited to offer that to our patients now. I have about 4 patients who have artificial pulmonary valves placed in the cath lab. So they have a procedure that for surgery would be usually a 7-day hospital stay. Now they go home the next day and they're doing well. So we're excited to offer that to our patients. We see their hearts start returning to a normal size and they function better, and they feel better and their perfusion's better. You know, it's our goal to help every child live their best life, whether it's a fully active life or a life reserved from some activity, but full of pleasures that they enjoy, and certainly full of the intellectual enjoyment that we have from just their coming back to clinic and interacting with us and our staff.